Welcome to this week's Al-Ghaf Dynamics HealthConnect Middle East podcast episode. Today, we will be once again discussing key events these past 7 days in the Middle East region across healthcare, life sciences, and wellness. Areas that are not only important to the Middle East population, but to the respective ministries, organizations, hospitals, healthcare providers, pharmaceuticals, biotech, and wellness groups. You will hear trends, insights, and the latest developments across the Middle East region for the week leading up to July 24, 2025. As always, our information is drawn from regional health ministries, pharma and biotech institutions, advanced data and news outlets coupled with our internal data gathering platform, HealthConnect Middle East. The week of July 17 to 24, 2025 showcased the Middle East's stark dualities in health and wellness. On one hand, several countries accelerated ambitious healthcare reforms, research collaborations, and digital health innovations, highlighting a regional drive toward modernization and self-reliance. Gulf states in particular, from the UAE and Saudi Arabia to Kuwait, Oman, Qatar, and Bahrain, announced new policies and partnerships to expand healthcare access, strengthen local workforces, and foster life science innovation. Cutting-edge medical achievements, such as a world-first cardiac surgery in Riyadh and planned vaccine breakthroughs in Tehran, underscored the Middle East's growing role in global health innovation. Concurrently, governments launched broad public health initiatives. Egypt and Jordan unveiled nationwide strategies to improve nutrition and climate resiliency in health, while health ministries across the region promoted wellness campaigns on issues like summer heat safety and chronic disease prevention. In sharp contrast, conflict-torn and crisis-hit areas of the region continue to face severe public health challenges. In the Gaza Strip, an already devastated health system descended further into an acute humanitarian catastrophe, with soaring child malnutrition and hospitals barely functioning amid war. Syria and Yemen likewise grappled with healthcare collapse and outbreaks of preventable disease under the strain of prolonged conflict. Even relatively stable countries like Lebanon struggled with the ripple effects of economic crisis, as shortages of electricity, staff, and medicine threatened basic care. A brutal heatwave sweeping parts of the Middle East added another layer of strain, prompting emergency measures to protect vulnerable populations from heat stress. This report details the week's major developments across all 14 Middle Eastern countries, from policy reforms and scientific advancements to outbreaks and wellness initiatives, revealing a region simultaneously pushing the boundaries of health innovation and coping with profound humanitarian crises. First is healthcare policy and government initiatives. Governments across the Middle East pursued significant health policy initiatives during the week, reflecting both long-term strategic reforms and urgent responses to current needs. In the Gulf, Oman made a notable workforce policy move. The Ministry of Health issued a directive mandating the Omanization of all pharmacies located in shopping centers and hospital premises. Under this new rule, pharmacy licenses for expatriate pharmacists will not be renewed, opening jobs to Omani graduates and advancing Oman's Vision 2040 goal of healthcare self-reliance. The decision was widely welcomed by young Omani pharmacists, who see it as creating long-awaited career opportunities and strengthening the local health sector. Neighboring Bahrain also focused on building its national health workforce. The government, through Tamkeen and the Supreme Council of Health, launched a support program in early July to train and employ 750 Bahraini healthcare professionals, including doctors, dentists, and nurses, in the private sector. This initiative, comprising 7 sub-programs of scholarships and incentives, aims to bolster Bahrain's healthcare human capital and aligns with broader economic reforms encouraging Bahraini efforts in high-skill sectors. Kuwait struck an international partnership to elevate its healthcare services. On July 19, Kuwait's Health Minister Dr. Ahmed Al-Awadhi signed 5 landmark cooperation agreements with leading French medical institutions in Paris. The Memoranda of Understanding, with prestigious centers such as Institut Curie and Hôpital Foch, are designed to improve Kuwait's local care delivery through telemedicine, specialist second opinions, and advanced training for Kuwaiti medical staff. Officials praised the agreements as a fresh start in leveraging France's medical expertise to benefit Kuwaiti patients at home, in line with the Emir's vision to reduce overseas treatment referrals. Key components include developing remote consultation services so Kuwaiti doctors and patients can access French specialists virtually, avoiding the need to travel abroad, and launching new fellowship programs for Kuwaiti physicians in French hospitals. Kuwait's initiative underscores a wider regional trend of health diplomacy and capacity building. Saudi Arabia, for instance, has in recent years inked agreements with global pharma and biotech firms, Merck KGaA, Vertex, and others, to localize production and knowledge transfer under its Vision 2030 health transformation. While no major new Saudi health legislation was reported this week, officials did announce that Riyadh will host the 2025 Global Health Exhibition in October as an international showcase of the kingdom's health sector progress. Saudi health authorities continue to implement Vision 2030 initiatives, from public-private partnerships to insurance and digital health reforms aimed at expanding access and improving quality of care nationwide. Elsewhere, governments addressed broad public health strategy. Jordan officially launched its National Climate Change Health Adaptation Strategy on July 16 in Amman, in collaboration with the WHO. The new 10-year strategy provides a comprehensive roadmap to bolster Jordan's health system resilience against climate-related risks. It identifies 7 priority climate-sensitive health areas, including heat-related illness, respiratory diseases, water and vector-borne infections, and nutrition, and lays out actions to integrate health in climate policies, strengthen early warning systems, and build institutional capacity for climate adaptation. Jordan's Ministers of Health and Environment jointly endorsed the plan, highlighting its inclusive development through cross-sector consultations and its alignment with the country's economic modernization drive. At the same time, Egypt unveiled a major intersectoral roadmap of its own, the National Food and Nutrition Strategy 2023 to 2030. During the second Egyptian Forum for Food Safety on July 15, Health Minister Dr. Khaled Al-Ghaf announced this strategy aimed at promoting healthy diets and strengthening food safety and security. The plan involves forming a high-level national committee on food and nutrition to coordinate efforts across ministries, finalize an action plan, and implement scientific monitoring of food production and handling. Emphasizing that safe, nutritious food is fundamental to public health, officials noted ongoing public awareness campaigns about food hygiene and the importance of basing policies on scientific evidence and international standards. Together, Jordan's and Egypt's initiatives show a growing recognition of health in all policies, tackling environmental determinants and nutrition as integral parts of national health development. No significant health policy shifts were reported in Lebanon or Syria this week, as their governments remain preoccupied with economic turmoil and conflict. In Iraq, the health sector continued its steady post-conflict rebuilding without a headline policy announcement during the week. However, across the Palestinian territories, governance of health was overshadowed by humanitarian needs. The Palestinian Ministry of Health in the West Bank coordinated with international agencies to stockpile supplies and keep services running amid fears of spillover from the Gaza war, while also supporting Gazan health officials under extremely constrained conditions. Meanwhile, Iran pressed forward with its long-term health and science development plans, detailed in Sections 3 and 8, rather than introducing new legislation this week. Overall, the period saw Middle Eastern governments leveraging policy tools, from workforce nationalization and international partnerships to national strategies on food and climate, to fortify their health systems for the future. Next is life sciences and research innovation. The week brought notable advances in medical science and research across the region, led by a historic surgical innovation in Saudi Arabia. Doctors at Riyadh's King Faisal Specialist Hospital and Research Center, KFSHRC, successfully performed the world's first robotic-assisted bilateral ventricular assist device, BiVAD, implantation in a human patient. In this groundbreaking procedure, announced July 22, surgeons implanted 2 artificial heart pumps, for both the left and right ventricles, using minimally invasive robotic surgery on a 61-year-old male patient with end-stage heart failure. Traditionally, such biventricular support requires a major open-heart operation. Instead, the KFSHRC team, led by Dr. Feroz Khalil, utilized high-precision robotic arms through small incisions to place the pumps. This technique dramatically reduced blood loss and infection risk and enabled a faster recovery. The patient was reportedly mobile just days after the surgery. The feat opens new horizons for advanced heart failure treatment, offering hope to patients too frail for transplant. It also cements Saudi Arabia's reputation as a regional leader in cardiac research and innovation. The hospital described the achievement as a culmination of years of research and a milestone for their cardiac surgery program. International medical journals and cardiovascular experts have hailed the robotic BiVAD implantation as a significant contribution to global cardiac science, likely to spur further research into robotic surgery for complex cardiac care. Saudi Arabia saw other research strides as well. In an academic collaboration, scientists at King Abdullah University of Science and Technology, KAUST, unveiled a novel AI-powered tool for embryology research. Announced on July 21, the Deep Blastoid system uses deep learning algorithms to analyze microscopic images of lab-grown human embryo models, blastoids, with accuracy comparable to an expert, but up to 1,000 times faster. By processing vast image datasets in seconds, this tool will vastly accelerate studies of early human development, allowing researchers to scale up experiments and screen how various conditions or chemicals affect embryo formation. KAUST researchers explained that ethical and practical limits have long constrained embryo research, but Deep Blastoid enables them to glean insights from thousands of blastoid images where manual analysis would be prohibitive. This promises to advance understanding of fertility, pregnancy disorders, and developmental biology. The project reflects the growing research capabilities of Gulf institutions. KAUST and others are increasingly contributing to cutting-edge life science fields such as genomics, stem cells, and AI in medicine. Elsewhere in the region, governments and universities demonstrated a sustained commitment to health research and innovation. In the UAE, the Ministry of Health and Prevention continued to foster a robust medical research ecosystem. The ministry's National Center for Health Research has been cultivating local research talent and hosted its annual scientific conference on health and medical research to showcase Emirati studies and encourage evidence-based healthcare improvements. The UAE also doubled down on integrating advanced technology into healthcare, with its newly established Artificial Intelligence Office driving pilot projects to apply AI tools in clinical settings and health administration. These initiatives feed into the UAE's broader vision of becoming a global healthcare innovation hub, a role reinforced by the country's high-profile collaborations, for instance, Dubai's partnership with international institutions on genomic medicine and Abu Dhabi's investment in biotech startups. In Qatar, the emphasis on research and training the next generation continued. Over the summer, programs like the Weill Cornell Medicine Qatar Biomedical Research Internship for students and the Qatar Genome Program's studies into genetic disease predispositions exemplify Qatar's investment in life science R&D. Meanwhile, Egypt worked to strengthen its research ties with global agencies. In mid-July, Egypt's health minister met with WHO experts to review cooperation with the Egyptian Drug Authority on clinical trials and pharmacovigilance, an effort to ensure that Egypt's pharmaceutical research and regulation are at international standards. Egyptian academia also remained active in public health research, from nutritional studies supporting the new food strategy to clinical research at the Children's Cancer Hospital, despite funding challenges. Iran, for its part, made headlines by approaching the launch of a locally developed cancer vaccine, an outcome of sustained investment in biotechnology research under the Ministry of Science and Technology. Across the Middle East, these examples illustrate a clear trend. Even amid practical challenges, countries are prioritizing science, research, and innovation as key pillars of their health development, aiming to produce homegrown solutions and contribute to global medical knowledge. We now move to biotech and pharmaceutical developments. The drive toward pharmaceutical self-sufficiency and innovation was evident this week in multiple Middle Eastern countries. In the United Arab Emirates, authorities moved to strengthen domestic drug manufacturing through international partnerships. Abu Dhabi's Department of Health signed a partnership with U.S. healthcare company Abbott to localize pharmaceutical production in the UAE. Inked during a biotech industry convention in Boston, the deal will see Abbott set up local manufacturing for its medicine portfolio and collaborate on developing new biosimilars, generic biotech drugs, as well as digital health solutions and workforce training. UAE officials welcomed the partnership as a strategic step to bolster the country's medicine supply security, reduce import dependence, and accelerate the availability of innovative therapies for UAE patients. This is part of a broader Emirati push in life sciences. Abu Dhabi's Mubadala investment company, for example, recently launched Mubadala Bio, a global pharma company that will produce billions of doses of medicines, including in 6 UAE-based facilities, to position the Emirates as a manufacturing hub. The UAE has also updated its regulatory framework to attract pharma firms. A new law enacted in late 2024 streamlines licensing and oversight of medical products to foster industry growth. With these moves, the UAE aims to join regional leaders like Saudi Arabia in becoming a center for pharmaceutical production and innovation. Iran made a major announcement in the pharmaceutical arena, signaling significant progress despite sanctions. On July 1, reported in local media this month, Iran's Health Minister Dr. Bahram Zafargandi unveiled 23 new domestically produced medicines and vaccines as part of an initiative to expand Iran's pharmaceutical self-reliance. The new products include treatments for chronic and critical illnesses and the launch of local manufacturing lines for important vaccines such as the HPV vaccine, for cervical cancer prevention, and a pentavalent pediatric vaccine. These advances are tied to Iran's national medicines strategy, which prioritizes reducing imports and enhancing the country's capacity to meet its own healthcare needs. This is just the first step, Iran's health minister said, emphasizing plans for large-scale production of cancer drugs and other vital therapies in the near future. Iran has invested heavily in its pharmaceutical infrastructure, exemplified by the development of the sprawling Barkat pharmaceutical town near Tehran, which was highlighted as a key hub for producing innovative medicines and vaccines. By closing technology gaps and achieving domestic production of items like the HPV vaccine, Iranian officials noted, the country can save foreign currency and improve public health security. In a related breakthrough, Iran is preparing to unveil a homegrown anti-cancer vaccine by summer 2025, developed by the National Institute of Genetic Engineering and Biotechnology. Institute representatives reported that Iranian biotech firms have achieved 70% self-sufficiency in this vaccine's production and are confident they can soon meet 100% of national demand. The forthcoming cancer vaccine, which targets certain tumor types, will mark a milestone in Iran's biotech industry, potentially reducing the need for expensive imported cancer medicines and making treatment more accessible for Iranian patients. These developments underscore how Iran, despite economic pressures, continues to advance a robust pharmaceutical and biotech program through indigenous innovation. Gulf states also reported strides in pharmaceuticals. Saudi Arabia has been actively encouraging local manufacturing of drugs and vaccines as part of its vision to localize 40% of pharmaceutical production. While no new pharma plants opened in Saudi this week, officials pointed to recent successes, a partnership with Merck to establish a Saudivax facility for vaccine and biologics production, and a joint venture to produce gene therapies with Vertex. Both deals signed in late 2024 are now in implementation. Moreover, Saudi Arabia's FDA approved several new locally made generic drugs in 2025, and construction progressed on a large insulin production plant in Jeddah. Bahrain and Oman also took steps to modernize their pharmaceutical sectors. In Bahrain, authorities are rolling out a national health insurance program, to be branded Sehati, that is stimulating demand for local pharma distribution and prompting regulators to update pharmacy practice standards. Oman, for its part, hosted regional regulatory forums, like the GCC Pharma Summit in June, and introduced updated guidelines for licensing and pharmacovigilance, signaling its intent to attract investment by ensuring a stable regulatory environment. Egypt continued to collaborate with international partners on pharmaceutical development. During the week, Egypt's drug authority discussed with WHO delegations ways to boost local production of vaccines and oncology drugs, building on Egypt's recent success in producing its first doses of an mRNA COVID-19 vaccine with Chinese cooperation. Meanwhile, Jordan leveraged support from the World Bank and global vaccine alliances to maintain supplies of essential medicines and vaccines for its population and refugee communities, despite fiscal constraints. In summary, the Middle East showed clear momentum in pharma and biotech. Through a combination of local manufacturing initiatives, foreign partnerships, and research investments, countries are striving to ensure that essential medicines and cutting-edge therapies are available within the region. The UAE's Abbott deal and Iran's slate of new drugs exemplify a shared goal of reducing dependency on imports and enhancing health sovereignty. At the same time, these developments will bolster economic diversification, creating jobs in high-tech manufacturing and potentially turning the region into an exporter of vaccines and generic drugs. While challenges remain, access to raw materials, regulatory alignment, and ensuring quality, the trend is unmistakable. The Middle East's pharmaceutical landscape is rapidly evolving, with long-term implications for healthcare affordability and innovation. Public health challenges and disease outbreaks is next. Palestine, Gaza Strip, the humanitarian health crisis in Gaza reached harrowing new depths this week. The WHO and aid agencies sounded alarms over an explosion of malnutrition and starvation as Israel's military offensive and blockade continued. In his July 23 briefing, whose Director General described Gaza's 2.1 million people as facing another killer on top of bombs and bullets, starvation. Since a breakdown of ceasefire on July 17, Gaza's therapeutic feeding centers have been overwhelmed with severely malnourished children, yet lack the supplies to treat them. At least 21 children under 5 have died of malnutrition in 2025 as of this week, and rates of global acute malnutrition in Gaza's children have soared above 10%, an alarming level. Over 20% of pregnant and breastfeeding women screened are themselves acutely malnourished, indicating widespread hunger. The hunger crisis is compounded by the near-total collapse of aid pipelines and people's inability to access food. Gaza's hospitals, meant to be refuges, are anything but. Most have been bombed, damaged, or cut off from power and supplies, rendering them non-functional. A handful of facilities still operating at minimal capacity and without anesthesia, antibiotics, or fuel regularly come under attack. Even the WHO's own staff shelter and main warehouse in central Gaza were stormed by Israeli forces on July 21, with personnel detained and vital medical stockpiles destroyed. In Gaza City's largest hospital, Al-Shifa, doctors performed surgeries by the glow of mobile phones as generators failed. WHO officials issued urgent appeals this week for unimpeded humanitarian access, protection of health workers and infrastructure, and an immediate end to actions depriving civilians of food, water, and medicine. The Gaza situation, they warned, is a catastrophic public health storm combining trauma injuries, infectious disease outbreaks, and now mass malnutrition that will have generational health impacts if not addressed. Syria. In Syria's conflict zones, public health conditions also deteriorated. The focus this week was on the besieged southern city of As-Suwaida, where weeks of unrest and isolation have created a severe healthcare vacuum. WHO reported that the main hospital in As-Suwaida is overwhelmed and critically undersupplied. Medical staff there are struggling to treat patients without adequate electricity, power cuts are frequent, running water, or essential medicines. Shortages of surgical supplies and antibiotics are life-threatening, especially as trauma cases arrive from sporadic clashes. The WHO is investigating reports that even this overstretched hospital has come under violent attack, including incidents of ambulances and health workers being targeted, a flagrant breach of international humanitarian law. Throughout Syria, after more than a decade of war, many areas lack functional healthcare. In the northwest, millions remain vulnerable to disease outbreaks in crowded displacement camps. In the northeast, recent displacement from camp closures has disrupted vaccination programs. While no new large-scale disease outbreak was confirmed in Syria this week, the risk of cholera and measles remains high in poor sanitation settings. Syrian health authorities, with support from UNICEF and WHO, have tried to keep routine immunizations going and last month held a polio vaccine round in Idlib, but ongoing fighting and access barriers impeded coverage. The WHO reiterated that healthcare must never be a target, urging all parties to protect medical units so that at least basic and emergency services can reach civilians in places like As-Suwaida. Without safe corridors for supplies and referral of critical patients, Syrian doctors fear increased fatalities from otherwise treatable conditions. Yemen continues to battle overlapping public health crises under the shadow of war. A measles outbreak in the country has surged, highlighting the consequences of gaps in vaccination. In Dhamma Governorate, central Yemen, Medicines Sans Frontières, MSF, reported treating over 1,400 cases of measles between April and July 2025, a 219% increase compared to the same period a year prior. Over half of those infected are children under 5 years old, many of them from communities with low immunization coverage. MSF warned this week that the outbreak is severe and growing, fueled by factors such as plummeting vaccination rates, restricted access to healthcare in Houthi-controlled areas, and even anti-vaccine rhetoric in some communities. The organization has set up an isolation ward in Al-Wada Hospital in Marbar City and deployed mobile clinics to 6 affected districts to manage cases. However, Yemen's broader healthcare collapse, hospitals lack supplies, many health workers have emigrated, and families often cannot afford transport to clinics, means the actual measles toll is likely higher. In response, Yemeni authorities in government-held areas, with support from WHO and UNICEF, launched a polio immunization campaign from July 12-14. This 3-day drive targeted over 1.3 million children under age 10 in 120 districts with the novel oral polio vaccine type 2, aiming to halt an outbreak of circulating vaccine-derived poliovirus detected in environmental samples. Health workers went house to house in high-risk areas, an effort made urgent by the confirmation of a few paralytic polio cases earlier in the year. While Yemen recorded the world's largest cholera epidemic in the late 2010s, cholera cases in 2025 have been comparatively lower. Nonetheless, the rainy season brings renewed cholera risk and NGOs are pre-positioning treatments in hotspot areas. Yemen's Ministry of Public Health, split between Aden and Sana'a authorities, continues to appeal for more international aid to sustain primary healthcare and outbreak response. With malnutrition rates also high, especially in children in the north, Yemen faces the deadly interplay of infection and famine. Humanitarian agencies stress that only a lasting peace and major health system investment can break this cycle, but interim measures like mobile vaccination teams and rapid response to disease alerts are crucial to prevent further loss of life. Beyond conflict settings, other public health challenges demanded attention around the region. A severe heatwave swept across parts of the Middle East in mid-July, raising health concerns in countries like Egypt and Iraq. In Egypt, the National Weather Service warned that a searing heatwave would persist for 2 weeks, with temperatures in Upper Egypt soaring well above 40 degrees Celsius. The Ministry of Health issued advisories for the public to avoid direct sun exposure, stay hydrated, and refrain from outdoor activities during midday. Hospitals in Cairo and other cities saw an uptick in heat exhaustion cases. Emergency rooms were placed on alert to treat heat stroke, especially among the elderly and those fasting for Tasu'a and Ashura, which fell during this hot spell. Gulf countries also implemented seasonal worker protections. For instance, the UAE's midday work ban, prohibiting outdoor labor at peak heat hours, was in full effect, backed by the 14th annual heat exhaustion prevention campaign led by the Ministry of Health. Throughout July and August, UAE health teams, in collaboration with labor authorities, have been distributing educational materials, cool drinking water, and electrolyte supplements to outdoor workers while inspecting work sites for compliance. Oman, Qatar, and Bahrain ran similar heat safety campaigns, leveraging social media and community outreach to warn about heat cramps and dehydration. In Qatar, for example, the Ministry of Labor this week held an awareness seminar for companies on preventing heat stress in workers, complementing the Health Ministry's public tips, see Wellness section. These efforts helped mitigate serious heat-related incidents despite extreme weather. Meanwhile, Lebanon confronted the lingering threat of communicable disease resurgence amid its sanitation and water crisis. A WHO situation update noted that by late June, Lebanon had recorded over 4,300 cases of acute watery diarrhea in 2025, but no laboratory-confirmed cholera cases so far, a relief given last year's cholera outbreak, and likely attributable to robust surveillance and water treatment measures. Still, heavy strain on Lebanon's public utilities, with electricity outages affecting water pumping and sewage treatment, means the country remains vulnerable to sporadic hepatitis A and bacterial diarrhea outbreaks, particularly in poorer areas and Syrian refugee camps. Public health experts in Lebanon are lobbying for emergency aid to supply fuel to water facilities and ensure chlorination of drinking water, hoping to avert any summer uptick in waterborne diseases. In summary, while conflict-driven crises captured headlines, health officials across the Middle East also had to stay vigilant against environmental and epidemiological challenges ranging from extreme heat to infectious diseases, underscoring the importance of resilient public health systems in the face of multiple stresses. Always key to discuss is wellness and health promotion. Governments and health organizations in the region continue to emphasize wellness, prevention, and healthy lifestyles through various campaigns this week. In Qatar, the Ministry of Public Health launched a broad summer health awareness campaign to encourage healthy habits during the hot season and holiday travel period. Beginning July 23, the ministry rolled out a series of educational messages across social media and local media, offering practical health tips for the public. These guidance ranged from advice on nutrition and physical activity, for example, urging people to maintain a balanced diet and to exercise in shaded or indoor areas to avoid the extreme heat, to precautions for common summer risks. One focus is on sun safety. The campaign reminds individuals to use sunscreen, wear protective clothing, and stay hydrated to prevent heat exhaustion or heat stroke. Another focus is safe travel and recreation. As many Qataris travel abroad or head to the beach during summer holidays, the health ministry's messaging includes reminders for travelers to get recommended vaccinations well before their trips, tailored to destination-specific risks. The campaign also advises carrying an adequate supply of prescribed medications and continuing healthy routines while traveling, such as making time for exercise and choosing nutritious foods even on vacation. Dr. Salah Al-Yafi, Director of Qatar's Health Promotion Department, noted that these efforts are part of the ministry's mandate to promote the health of community members and protect them from chronic diseases by instilling healthier behaviors year-round. By leveraging popular platforms like Instagram, Twitter, and local TV, Qatar's summer wellness campaign aims to reach a wide audience and reduce seasonal health issues, such as heat-related illnesses, travel-related infections, and lapses in chronic disease management during holidays. Saudi Arabia has also sustained momentum in public wellness initiatives, particularly in combating lifestyle-related diseases. Though the kingdom's major anti-obesity campaign kicked off in late June, its impact carried into this week with ongoing activities under the banner, A Nation Without Obesity. Organized by the Ministry of Health in partnership with private and non-profit groups, this initiative sets out to treat obesity as a national health priority rather than a stigma. Over the past month it has provided free screenings and consultations at clinics and malls across Riyadh and other cities, aiming to reach 1 million people in its first phase. Public health experts in Saudi Arabia used campaign events to stress that obesity is a complex chronic disease requiring long-term management, not merely a lifestyle choice, and highlighted available support from new dedicated obesity clinics and weight management programs. The campaign also emphasizes psychological wellness. By trying to eliminate the social stigma around obesity, officials hope more individuals will seek help without shame. As part of Vision 2030's Quality of Life program, Saudi authorities are integrating such wellness promotion with improvements in urban design, more parks and walking paths, and school health education to foster healthier habits from an early age. Early reports indicate strong public engagement. For instance, community sports groups and fitness influencers have been involved in spreading the campaign's message that achieving a healthy weight is a collective effort supported by Saudi society and its healthcare system. Several countries marked wellness observances and community health events during the week. Oman celebrated its annual Walk 30 initiative earlier in the summer, a nationwide fitness challenge encouraging people to walk 30 minutes a day, and its spirit continued as many Omanis adjusted their walking routines to cooler times of day in July. Oman's Ministry of Health reinforced messages about staying active safely, noting that even more walking and home exercise can help maintain fitness when outdoor conditions are harsh. In the UAE, preparation was underway for World Hepatitis Day. Coming up on July 28, the Health Ministry and Emirates Health Services promoted free hepatitis screenings and ran awareness ads about hepatitis prevention, like avoiding needle sharing and getting vaccinated. The UAE is also set to host events for World Breastfeeding Week in early August to promote infant nutrition, reflecting an ongoing commitment to maternal and child wellness. Bahrain, known regionally for its pioneering Healthy Cities program, expanded that concept this year, and though no new city was certified healthy this week, authorities are working within 3 governorates to implement Healthy Governorate standards that incorporate wellness in all local policies. This includes everything from ensuring ample green spaces for exercise to running mental health support groups at community centers. Such cross-sector efforts show how deeply Bahrain has institutionalized the principle of wellness. Since 2018, it has had 4 WHO-designated healthy cities, and now it aims to scale up healthy living initiatives to entire regions of the country. Meanwhile, Lebanon and Iraq relied on civil society and NGOs to fill gaps in health promotion. In Lebanon, amid the health system's struggles, the Order of Malta's clinics and local NGOs organized wellness fairs offering free blood pressure and diabetes checks to high-risk populations, as hinted by social media on July 23, a small buffer against the neglect of preventive care. In Iraq, July saw the health ministry partner with community leaders in Basra to campaign against smoking and drug use among youth, indicating a focus on social aspects of wellness post-conflict. Taken together, the region's wellness and health promotion activities reflect a crucial shift, an increasing emphasis on preventive healthcare and healthy lifestyles as complements to traditional medical services. From mass media campaigns about healthy eating and exercise to targeted interventions for obesity, smoking cessation, and mental health, Middle Eastern countries are acknowledging that many of their pressing health challenges, like diabetes, heart disease, and stress-related disorders, require community-wide changes in behavior and environment. The use of creative outreach, whether Qatar's online infographics, Saudi Arabia's public-private campaigns, or community-driven projects in Bahrain, shows a recognition that governments alone cannot impose healthier living, but they can lead, facilitate, and encourage it. As these wellness programs mature, officials are watching for measurable outcomes, such as reductions in obesity rates or improvements in fitness levels, in the years ahead. The hope is that today's heightened health awareness will translate into a healthier, more productive population resilient against both chronic disease and future public health threats. Now we turn to digital health innovation. Advancements in digital health continued to transform Middle Eastern healthcare systems this week, as countries expanded e-health services and embraced telemedicine and AI solutions. Kuwait reported major progress in its national digital health rollout. At a press conference on July 23, the Ministry of Health highlighted how dozens of government health services are now offered through online platforms, improving convenience for patients. The ministry's spokesman noted that 23 healthcare services have been integrated into Kuwait's Sahel mobile app, which serves as a one-stop e-government portal. 104. These include services like online medical appointment booking, e-prescription refills, viewing lab results, and paying health insurance fees electronically. The uptake has been strong. Over 338,000 users accessed Ministry of Health e-services via Sahel in the first half of 2025. Additionally, since the launch of the ministry's electronic patient portal, My Patient, last October, more than 3.9 million transactions have been logged on that system. Officials revealed that this digital shift is already yielding public health benefits. The ease of online consultations and follow-ups contributed to a drop in unnecessary visits to primary health clinics, from 15.5 million visits in 2022 to 13.2 million in 2024, trend continuing in 2025. Kuwait also introduced new digital tools to enhance emergency care. On July 10, it launched a First Responder digital dispatch project comprising 28 ambulatory units equipped with GPS and telemedicine links, which handled 70 emergencies in their first week and significantly cut response times in underserved areas. Furthermore, Kuwait installed 20 automated external defibrillators, AEDs, at Kuwait International Airport and other transit hubs, networked to a central system so that nearby trained personnel can be alerted immediately when someone experiences cardiac arrest. A training program is underway to ensure airport staff can use the devices, underscoring how digital connectivity and upskilling are improving the chain of survival for medical emergencies. Telemedicine gained new momentum as a cost-effective way to broaden specialist access. As noted earlier, Kuwait's agreements with French hospitals will establish teleconsultation services that allow Kuwaiti doctors and patients to seek second opinions and remote expertise from France in fields like oncology and cardiology. This week, Kuwaiti health officials outlined how these services will work. For example, a Kuwaiti oncologist could virtually present a complex cancer case via a secure platform to a tumor board at Institut Curie in Paris, getting input on advanced treatment options without transferring the patient abroad. Likewise, French experts will remotely train Kuwaiti clinicians on new surgical techniques and protocols. Such telemedicine links are expected to sharply reduce the number of Kuwaiti patients sent overseas, currently a major expense for the government, while improving care quality at home. Saudi Arabia built on its own telehealth infrastructure during the Hajj season and is now looking to extend those capabilities nationally. During Hajj 2025 in June, Saudi authorities expanded the Sayha virtual hospital network, enabling pilgrims in Mecca to consult specialist doctors in Riyadh or Jeddah via telemedicine carts, and activated around-the-clock teleconsultations through the Sehati mobile app for urgent medical advice. They also deployed AI-enabled systems to automatically translate and triage the multi-language medical calls from pilgrims, which improved efficiency. This week, the Ministry of Health reported that these digital systems cared for thousands of pilgrims and would be mainstreamed into regular health services. For instance, the virtual hospital is slated to connect all major hospitals in the kingdom by year-end, bringing subspecialty care to remote regions through virtual rounds and consultations. Additionally, Saudi Arabia's trial of drone delivery for medical supplies in Mecca, which cut delivery times from 90 minutes to 6 minutes during Hajj, demonstrated the potential of integrating drones into emergency response in civilian settings. Several countries are harnessing artificial intelligence, AI, to enhance healthcare delivery. In the UAE, the Ministry of Health's Artificial Intelligence Office, established to drive digital transformation, announced ongoing projects using AI to streamline administrative processes and support clinical decision-making. One example is an AI-powered appointment scheduling system being piloted in Ajman that optimizes doctor availability with predicted patient no-show rates. Another is a collaboration with Dubai's health authority to use machine learning algorithms for radiology, which can flag abnormal chest X-rays for faster review by clinicians. The UAE is also exploring AI chatbots to answer patient inquiries on its 24/7 telemedicine hotline, an initiative that could launch later this year. Iran has been investing in digital health under its Smart Health initiative. This week, Iranian researchers highlighted their development of a decision support AI for early cancer detection that analyzes patient records and suggests screening tests, a tool in testing at select hospitals. Oman and Bahrain are not far behind. Oman's Ministry of Health reported in June that its new national health insurance digital platform, Damani, has an AI module to detect fraudulent insurance claims and ensure appropriate billing. Bahrain, for its part, has implemented an AI-based system in Salmania Medical Complex to predict patient influx, using patterns from weather, traffic, and historical data, so that staffing in emergency and outpatient departments can be adjusted proactively, a system that proved valuable during recent COVID-19 waves and is now a permanent feature. Region-wide, governments are also focusing on expanding health information systems and connectivity. Jordan this week upgraded its Hakim e-health system, which digitizes patient records in public hospitals, to a newer platform that will eventually allow data exchange with private clinics, making patient histories accessible wherever they seek care. Egypt announced that over 90% of hospitals in 3 governorates, Ismailia, Luxor, and South Sinai, are now linked into its unified health information system as part of the phased universal health insurance rollout, improving referral management and reducing duplicate testing. And in conflict areas like northwest Syria and Yemen, international NGOs introduced simple digital tools, like tablet-based apps for epidemiological surveillance and mobile data collection, to better monitor disease outbreaks and the delivery of aid. Crucially, these digital innovations are often accompanied by legislative and regulatory support. For example, on July 19, Qatar's cabinet approved a draft law on the regulation of telehealth services, which will formally license telemedicine providers and set standards for patient data privacy in virtual care. Similarly, the UAE last year issued guidelines for AI in healthcare to ensure algorithms are evidence-based and ethically deployed. Compliance with these standards is being checked as AI projects, like the ones mentioned, advance. The emphasis is on marrying innovation with patient safety and data security. In summary, the Middle East's healthcare system is visibly going digital, with this week's developments illustrating multiple facets of that transformation. Patients are increasingly booking appointments, accessing test results, and consulting doctors through their smartphones. Emergency response is being quickened via digital dispatch and telepresence. AI is gradually moving from pilot to practice, assisting human providers in tasks ranging from image analysis to logistics. And telemedicine is collapsing distances, whether for a pilgrim in Mecca or a cancer patient in Kuwait, by bringing expert care virtually to the bedside. These investments in digital health are expected to improve efficiency, broaden access, especially for rural or underserved communities, and make the health system more resilient, a fact appreciated during the pandemic and now becoming ingrained in health strategy. Challenges remain, such as ensuring internet connectivity in remote clinics, training healthcare workers in new technologies, and protecting sensitive health data from cyber threats. Nonetheless, the trajectory is set. Digital health innovation is becoming a cornerstone of Middle Eastern healthcare planning, promising long-term gains in health outcomes and system sustainability. Finally, we have population health management. Middle Eastern nations took a variety of approaches to manage the health of their populations at scale, focusing on preventive care, community-based services, and broad access to essential interventions. Egypt stood out with the rapid expansion of its nationwide health campaign. The 100 Days of Health initiative, a sweeping public health drive launched by the government, entered its third iteration on July 15 and delivered impressive results in its first week. By July 19, the Health Ministry announced that in just the first 3 days of this campaign's latest round, medical teams had provided over 5.06 million free health services to Egyptians across all 27 governorates. These services spanned a range of preventive and primary care areas. Over 600,000 people received care through primary healthcare and family planning units, with a focus on reproductive health, antenatal checkups, and contraception counseling. Nearly 362,000 patients were seen in hospitals for therapeutic care, including surgeries and specialist consultations arranged by the campaign. More than 205,000 services were provided through Egypt's health insurance hospitals for insured individuals. In addition, the campaign facilitated about 5,400 emergency cases via the National Ambulance Service. Public outreach is a key component. In the span of a few days, over 85,000 citizens received health education sessions from community outreach teams deployed in busy public spaces like markets, youth clubs, and malls. These teams disseminate information on topics such as chronic disease prevention, nutrition, hygiene, and how to navigate Egypt's health services. The 100 Days of Health campaign, launched under the direct order of President El-Sisi, is essentially a mass mobilization of the health sector to deliver quick wins in healthcare access, leveraging thousands of medical convoys, mobile clinics, and temporary screening posts. It addresses everything from screening for diabetes and hypertension to distributing free medications for parasites and chronic conditions. Notably, this campaign builds on the success of past Egyptian public health mobilizations, like the 2018-19 hepatitis C elimination drive, and serves as a mechanism to jumpstart utilization of the newly extended universal health insurance system in pilot provinces. The sheer scale of reaching millions in days underscores how Egypt is managing population health by bringing services directly to the people, especially those in underserved or rural areas who may not regularly visit health facilities. Countries also focused on targeted population health interventions for vulnerable groups and remote regions. In Yemen, a unique collaboration between the UAE and WHO turned its attention to Socotra Island, a remote archipelago with distinct health challenges. Field teams from UAE's humanitarian agencies and WHO completed the first phase of a comprehensive health and nutrition survey in Socotra by mid-July. Over multiple expeditions to far-flung villages, they gathered baseline data on nutrition status, for example rates of child stunting and acute malnutrition, prevalence of diseases, and the state of local health facilities. This assessment will inform a multi-year joint program to reduce mortality from malnutrition and improve healthcare access on Socotra. The plan includes deploying periodic medical missions, establishing a supply line for essential medicines, as Socotra is often cut off during monsoon season, and community education on nutrition and hygiene. Given that Socotra faces recurrent outbreaks of cholera, dengue, and measles, as noted by WHO, the program also aims to strengthen outbreak early warning and vaccination coverage on the island. This example illustrates population health management on a micro scale, tailoring a strategy to a specific isolated population's needs. Likewise, in Jordan, the Health Ministry, alongside UN agencies, continued extensive health services for Syrian refugees under the Jordan Response Plan. As of this week, over 17,000 Syrian refugees in Jordan have voluntarily repatriated in 2025, but around 1.3 million remain. Jordan's network of health clinics in refugee camps, like Zatari and Azraq, and urban areas provided tens of thousands of consultations this month, including maternal care and psychosocial support, to manage the population health of this displaced group. A self-organized return briefing on July 20 noted that health education is part of pre-departure orientations for refugees choosing to go back to Syria, ensuring they carry vaccination records and information on continuing treatment across the border. Investments in preventive health and early detection were a priority in the Gulf states' population health strategies. Kuwait reported encouraging data from its national screening programs and chronic disease management initiatives. The Ministry of Health revealed that the number of women undergoing breast cancer screening has climbed significantly as new mammography units have been installed across primary care centers. In 2023, only about 1,100 women came forward for breast cancer screening in pilot programs, but with vigorous awareness campaigns and the expansion of clinics, over 8,100 women were screened in 2024, and an additional 4,275 women have been screened in the first half of 2025. This exponential increase reflects growing public trust in preventive services and the impact of outreach efforts urging women over 40 to get regular mammograms. Detected cases are being fast-tracked into treatment, potentially improving survival rates. Kuwait also touts its home care program for bedridden patients, which served 872 elderly and disabled patients with regular home nurse visits in H1 2025. Based on its success, health officials announced plans to extend home healthcare to pediatric patients with chronic conditions later this year. This expansion means children who are bedridden or have special needs could receive medical care, like physiotherapy, nutritional support, and medication management, at home, reducing the strain on families and avoiding hospitalizations. Such community-based care models are increasingly part of population health management, ensuring continuity of care outside traditional settings. In the United Arab Emirates, population health efforts during the week included extensive free health screenings tied to national campaigns. In Sharjah, for example, local health authorities organized mobile clinics offering free screenings for diabetes, hypertension, and hepatitis in various districts as part of the 100 Days of Health concept that UAE has also embraced, inspired by Egypt's model. Data from these screenings feed into the UAE's national health database to map chronic disease prevalence and guide resource allocation for clinics and patient education. Oman has similarly scaled up chronic disease registers in primary care. As of July, every patient with diabetes or hypertension in Oman is supposed to have an individual care plan and receive at least 2 wellness check calls per year from nurses, an initiative showing Oman's quietly effective primary healthcare system at work. International agencies continue to support population health in fragile contexts. Lebanon's health sector, co-led by the Ministry of Public Health and WHO, maintained a surveillance system that monitors trends in communicable diseases nationwide, which is how they quickly detected no cholera resurgence so far despite risk factors. They also managed a network of over 200 primary healthcare centers, PHCs, offering subsidized or free care to both Lebanese and refugees. By pooling donor funds, these PHCs delivered a basic package of vaccinations, antenatal care, and medications to hundreds of thousands of people this year. This week, the Health Ministry in Lebanon launched a cholera preparedness refresher training for PHC nurses given the ongoing vulnerability. In Iraq, the government's population health focus has been on rebuilding trust in the public health system after years of conflict. Immunization teams carried out follow-up rounds of a national measles vaccination campaign that began in spring, aiming to reach children who were missed earlier. They reported that by July 20, measles vaccine coverage in high-risk districts, for example, parts of Mosul and Anbar, increased from around 60% to over 80% thanks to door-to-door efforts and involvement of community leaders, an important gain for herd immunity. Overall, population-level health management in the Middle East is characterized by proactive campaigns and community outreach to bring services to the people, with a particular emphasis on preventative care. Whether through massive short-term campaigns like Egypt's or sustained primary care programs like Kuwait's home visits, the goal is to detect health issues early, intervene before diseases become advanced, and cover as many people as possible, including marginalized groups, with essential health services. These efforts face obstacles, of course, funding constraints, logistical challenges in remote areas, and in some cases public hesitancy or misinformation, like vaccine skepticism in parts of Yemen contributing to measles spread. Yet, the week's developments show health authorities striving to adapt solutions to their context, for instance, using community volunteers and mobile teams where clinics are sparse, or partnering with international donors to support refugee health. The strong initial results from campaigns such as 100 Days of Health indicate that when given the opportunity and access, populations do take up health services readily. Maintaining this momentum and institutionalizing these campaigns into regular health system functions will be key to achieving longer-term improvements in population health indicators across the region. So let's summarize this week's review. This week's health and wellness developments across the Middle East encapsulate a region of both remarkable progress and ongoing hardship. On one end of the spectrum, the Gulf countries and some neighbors are steadily fortifying their healthcare systems, rolling out visionary policies, unveiling cutting-edge medical feats, and investing in the well-being of future generations. We saw governments like Oman and Bahrain enact forward-looking workforce and training initiatives to empower their own citizens in health professions. Ambitious partnerships, such as Kuwait's telemedicine links with France and the UAE's manufacturing deal with Abbott, underscored a drive to integrate global expertise and secure health independence. In research and innovation, Saudi Arabia's historic robotic heart surgery and Iran's impending cancer vaccine breakthrough highlighted how regional institutions are contributing solutions at the forefront of medical science. Meanwhile, a pervasive digital transformation is knitting the region's healthcare together, from Kuwait's e-health services connecting hundreds of thousands of users, to AI tools in Saudi and the UAE, to telehealth networks transcending geographical barriers. These advances point to a future Middle East where high-tech, prevention-oriented, and patient-centric care becomes the norm, and where countries increasingly chart their own paths in medicine and pharmaceuticals. At the same time, the week's events painfully underscored the gulf that remains between these islands of excellence and areas engulfed in crisis. In conflict-ravaged Gaza, Syria, and Yemen, and to a grave extent in economically shattered Lebanon, basic health determinants like nutrition, sanitation, and safe hospitals are far from assured. The Gaza Strip's descent into a malnutrition catastrophe, with children starving amid siege conditions, is a stark reminder that war can unravel decades of health progress in a matter of months. Syria's chronically unstable south and northwest continue to report health system breakdowns and outbreaks that would be preventable in peace. Yemen, despite tentative ceasefires, still confronts the diseases of poverty and a healthcare void that external aid can only partially fill. Even Lebanon, once a regional medical hub, has seen its health system teeter due to governance failure and fiscal collapse. These crises are not contained by borders, they pose regional and global public health risks, from potential epidemic spread to mass migration, and present moral and humanitarian imperatives. The week's concurrent narratives highlight the urgent need for regional solidarity and international engagement to bridge the health divide. Initiatives like the Saudi and Qatari medical aid convoys to Gaza, or UAE's project in Socotra, are examples of how more stable states are stepping in. Yet, much more support and, critically, conflict resolution will be required to ameliorate the underlying drivers of these health emergencies. Regionally, certain common themes emerged. Non-communicable diseases, NCDs, obesity, diabetes, cardiovascular diseases are a universal challenge that Middle Eastern countries are tackling through campaigns and policy measures, like Saudi's anti-obesity initiative and Qatar's lifestyle education efforts. Climate and environmental health issues, too, have come to the fore, with Jordan's climate health strategy and widespread heatwave responses illustrating a growing awareness that health policy must adapt to a warming, water-scarce future. Additionally, the focus on preventive care and primary health, be it Egypt's mass screenings or Kuwait's home care and early detection programs, reflects a strategic shift toward managing health at the community level to reduce downstream costs and improve quality of life. If sustained, this emphasis on public health and prevention could bend the curve of rising healthcare expenditures and improve outcomes across the region's diverse socio-economic settings. As the Middle East moves forward, the coming weeks and months will test whether the positive initiatives highlighted can gain traction and whether acute crises can be mitigated. Several major health events and benchmarks lie on the horizon: the planned unveiling of Iran's cancer vaccine later this summer, the Global Health Exhibition in Riyadh in October, which will gather international stakeholders and possibly yield new collaborations, and the continued rollout of universal health coverage pilots in countries like Egypt and Bahrain. Furthermore, the region will soon enter the late summer period when the risk of infectious disease outbreaks, cholera, typhoid, MERS, can heighten, making ongoing vigilance essential. One encouraging sign is the degree of knowledge sharing now evident among Middle Eastern health authorities. This week alone saw examples of cross-border learning, Kuwait adopting French telemedical practices, Jordan, and other Arab states looking to Bahrain's Healthy Cities experience, and Egypt's highly successful hepatitis C campaign of past years serving as a template for Sudan and others. Such exchanges, often facilitated by WHO and regional bodies, mean that best practices in health management can diffuse more rapidly. In conclusion, the week's developments portray a Middle East whose health sector is at a crossroads of innovation and adversity. Many countries are demonstrating that with political will and strategic investment, they can deliver world-class healthcare and improve the everyday wellness of their people. At the same time, unresolved conflicts and inequities continue to exact an unacceptable toll, reminding the region that health security is indivisible. A disease outbreak or healthcare collapse in one area can quickly have repercussions beyond. The major trends observed, technological leapfrogging in service delivery, pivot to preventive care, and efforts to localize health solutions are likely to shape the Middle East's health landscape in the years ahead. If peace and stability can be restored in the fragile states, they will have a chance to benefit from these trends as well. For now, the Middle East presents a tableau of hope and concern, a region harnessing 21st-century tools to solve health challenges, yet still seeking answers to the age-old scourges of war, poverty, and disease. The coming period will show whether the foundations laid by this week's initiatives can yield a healthier, more resilient Middle East for all its peoples. For more information about any of the topics discussed here, or if you would like to learn more about Al-Ghaf Dynamics and our extensive range of services and solutions in healthcare, life sciences, and wellness for the Middle East, please don't hesitate to contact us. Visit us at our website or email us directly. Additionally, scan our QR code for all our links. Thank you for listening and see you next week.